Shared decision-making is a simple idea. It is a conversation. It happens between a patient and their healthcare provider. Together they make a health decision. This is not the old way. In the old way, the doctor often decided alone. The patient was told what to do. Shared decision-making changes this. It makes the patient an active partner. It is about working together to choose the best path forward for the patient's health. This approach respects the patient as a whole person, with a life and values that matter deeply in their care. This way of making decisions is very important today. People have more access to health information than ever before. Many patients want to be more involved in their healthcare choices. They no longer want to be passive recipients of care. For long-term conditions like diabetes or heart disease, patient involvement is key. The patient lives with the condition every day. Their active participation in choosing treatments that fit their life can lead to better management and overall well-being. Shared decision-making acknowledges this new reality and empowers patients within it. The heart of shared decision-making is a blend. It combines two kinds of expertise. The healthcare provider brings medical knowledge. They understand the disease, they know the treatment options, the benefits, and the risks. But the patient also brings crucial expertise. The patient is the expert on their own life. They know their values, their preferences, their goals, and their life circumstances. Both types of expertise are essential. One without the other leads to decisions that may not be right for the individual patient, even if medically sound. This approach is a significant shift from traditional medical practice. For a long time, healthcare often followed a paternalistic model. The doctor knew best, and the patient was expected to comply. Shared decision-making moves away from this. It is built on respect, empathy, and open communication. It recognizes the patient's autonomy and their right to be involved in choices that affect their body and their life. It is about making decisions patients, not them. This fosters a more humane and dignified healthcare experience for everyone involved. The healthcare provider plays a vital role in shared decision-making. Their first job is to explain the health situation clearly. They must describe all reasonable treatment options. This includes the option of doing nothing or watchful waiting, if appropriate. They need to use simple language, avoiding complex medical jargon. The provider should present the evidence for each option. This includes talking about the potential benefits. It also means being honest about the possible harms, side effects, and any uncertainties that exist. This clarity is the foundation for an informed choice. Beyond providing information, the provider must be an active listener. Their role is to help the patient explore what matters most to them. This means asking open-ended questions. What are your hopes for this treatment? What are your biggest fears? What activities are important in your daily life? How might this condition or treatment affect them? The provider needs to understand the patient's personal context. They must create a safe space where the patient feels comfortable sharing their preferences and values without judgment. This empathetic listening is crucial for true partnership. Patients also have a critical role in this collaborative process. They need to be prepared to share their perspective. This means thinking about their own goals for their health and their life. Patients should voice their concerns and ask questions until they understand. No question is too small or unimportant. They must express what is important to them, what trade-offs they are willing to make, and how different options might fit into their unique life circumstances. Their experiences, beliefs, and personal priorities are essential data points in the decision-making process. Ultimately, the patient's role is to be an active participant in the conversation. They should understand that their input is not just welcome, but necessary. They are a key member of the decision-making team. Shared decision-making empowers patients to make choices that are truly right for them. This is not about abandoning patients to make choices alone. It is about the provider supporting the patient. They work together to arrive at a decision that aligns medical evidence with the patient's deeply held values and personal circumstances. To help with shared decision-making, special tools have been developed. These are often called patient decision aids. They are not the same as standard patient education leaflets or brochures. These tools are specifically designed to help people understand and think through difficult health choices. They might be booklets, videos, or interactive websites. Option grids are another useful tool. These present choices in a clear, side-by-side format. The goal of these tools is to support the conversation between the patient and the provider, making it more structured and meaningful. These tools typically work by presenting balanced information about all reasonable options. They clearly lay out the potential benefits and harms of each choice. They often use plain language and visual aids to make complex information easier to grasp. Importantly, many decision aids include exercises or questions. These prompt patients to think about their own values and preferences. For example, a question might be, "What is more important to you? Avoiding a small risk of a serious side effect, or getting the maximum possible benefit from treatment?" This helps patients clarify what truly matters to them before making a choice. This is quite different from standard patient education materials. Traditional pamphlets or fact sheets often focus on giving information about a single condition or treatment. While useful, they usually do not explicitly compare different options. They rarely include prompts for value clarification. Standard materials aim to inform. Shared decision-making tools aim to help patients deliberate and prepare for a discussion. They are built to facilitate a two-way conversation and support the process of choosing among different, often complex, healthcare pathways. They are about empowering choice, not just conveying facts. It is also important to understand that shared decision-making is distinct from informed consent. Informed consent is a legal and ethical requirement. It typically involves a provider explaining a recommended procedure, its risks, benefits, and alternatives, and then obtaining the patient's signature on a form. This is often a one-way flow of information, focused on a single option. Shared decision-making, however, is a much broader communication process. It occurs earlier when multiple options are still on the table. It focuses on reaching a decision together, based on mutual understanding and respect for the patient's preferences. The benefits of shared decision-making for patients are significant. When patients are actively involved in choosing their treatment, they often feel more knowledgeable. They understand their options better. This leads to increased confidence in the decisions they make about their health. Research shows that patients who participate in shared decision-making are often more likely to follow through with the chosen treatment plan. This is because the plan aligns with their personal values and preferences. Ultimately, this can lead to improved health outcomes and a better quality of life for the patient. Beyond better adherence, patients experience other important benefits. They often report less decisional regret. This means they are less likely to look back and wish they had made a different choice. Satisfaction with care also tends to increase. Feeling heard, respected, and treated as a partner can make a profound difference in a patient's experience. This helps to build trust between the patient and their healthcare provider, and in the healthcare system as a whole. This trust is fundamental to good, ongoing medical care. It makes the often stressful experience of illness more manageable. Healthcare providers also benefit when they practice shared decision-making. It can lead to stronger, more trusting relationships with their patients. Many providers report greater job satisfaction. They find fulfillment in truly helping patients navigate complex choices in a way that honors the patient's individuality. It can also make clinical encounters smoother. When patients are engaged as partners, there may be fewer misunderstandings or feelings of being unheard. The burden of making difficult decisions, especially when there is no single best answer, is shared, which can be a relief. In conclusion, shared decision-making is more than just a technique. It is a fundamental shift towards more patient-centered and humane healthcare. It respects the dignity and autonomy of each individual. It leads to care that is not only medically appropriate, but also personally fitting. By bringing together medical expertise and patient wisdom, we create a path to better decisions, better adherence, and better experiences for everyone. Shared decision-making is essential for a healthcare system that truly cares for the person, not just the disease. It helps medicine remember its core purpose: to help people live well,